Hi, in this presentation I'd like to give a brief overview on diabetes. I'll introduce the various types of diabetes, the incidence of diabetes in America, and the complications that occur with chronic diabetes. Diabetes refers to an increase in urine volume. This increase in urine volume can occur in two main pathways. The first, termed diabetes insipidus, refers to dysfunction of the kidneys. This can both be dysregulation, in which the brain is no longer telling the kidneys to reabsorb water, or the kidneys actually losing the ability to reabsorb water and maintain adequate urine volume. The second main type of glucose in the bloodstream can actually result in spillage of glucose into the urine, which causes an increase in urine volume. Too much glucose in the bloodstream also can cause neurological damage and affect the cells in various different ways. The amount of glucose in the body is regulated by the secretion of insulin. Insulin is secreted from the pancreas, which tells the various cells in the body to absorb glucose and prevent abnormal levels of glucose. In type 1 diabetes, there's an autoimmune response in which the islet cells of the pancreas that secrete insulin are actually destroyed. This decreases the amount of insulin in the body and prevents the cells from reabsorbing glucose as normally would occur. Type 2 diabetes refers to insulin insensitivity. The problem here is actually, although there's insulin in the body, the cells are no longer responding to it normally. This decreases the amount of glucose absorbed and also increases the amount of insulin or amount of glucose in the bloodstream. In the United States, there are 300 million people. Approximately 8% are affected with diabetes, but an additional 16% are in a pre-diabetic state with some level of insulin insensitivity. If we break down the population into three main categories, in which people are less than 20, between 20 and 65, and over 65 years of age, we see an alarming trend. First, there's less than 1% of individuals less than 20 have diabetes, but 10% of individuals, or 11% of individuals between 20 and 65 are affected by diabetes. Whereas in the group above 65 years of age, almost 30%, 27% are affected with diabetes. Diabetes is associated with obesity, hypertension, and various lifestyle disorders, or various lifestyle choices that increases the amount of sugar and fat intake that an individual normally has. There are a lot of complications with diabetes. First, diabetes increases the risk of heart attack and stroke by 4 times. Diabetics are responsible for 40% of chronic kidney failure, or chronic kidney disease, in which they undergo dialysis, and is the leading cause of blindness in adults. Of diabetics, 70% will have neurological disorder or neurological symptoms throughout the course of diabetes, and 60% of amputations in the United States are the result of complications with diabetes. So it's really important to maintain good health and control the level of glucose in your body when you have diabetes.